during elective time, both pieces of training did healthcare for the homeless elective, so spent time in homeless shelters and working in clinics for the homeless, working on a mobile medical van for the homeless. Really, again, to get experience with working with patients who are going to be experiencing some of the same challenges that I saw my patients in my future career dealing with. So I think those are really were the crucial pieces for me.
To be honest, we've gotten a lot better in dental schools with bringing public health in. When I was there, it was something that needed to be sought out. Now they've really incorporated it in curriculum. If I were into dental school today, knowing then what I know now, the one thing I would search out would be, okay, who is the public health professor? Who is doing the SCOPE programs? Each school has a SCOPE initiative, which is just an outreach that allows dental students to go to different places that serve, people in the community health center kind of environment. So the advice I would give is to do that, but more importantly, to hone your craft. Because if you come to a community health center, your level of expertise does need to be a little bit higher than if in private practice.
Okay, una de esas y una me tocó más después.
If I could add anything to my skill set, the one thing that I wish I would have done is taken a medical Spanish course or even done international travel to do international medicine in a Spanish-speaking country. I just feel that many of my patients that are native Spanish speakers, that there still is a barrier in communication even through an interpreter. The best way to communicate with your patient is one-on-one, and without having that skill set, it's really tough to do.
In CUP, in Commitment to Underserved People, which we did in medical school, we had various community clinics. One was for homeless. There were various homeless clinics. There were a few women health clinics. We traveled around to teen organizations and gave talks. We were at domestic violence shelters and doing education. So I have been involved in this commitment to underserved people since medical school and known that this is what I wanted to do. Our program was actually all medical student run. So anytime we wanted a new service or we felt there was a need for a homeless clinic in this area, then we started it with the help, of course, of the medical school.